morning, afternoon, or evening, wherever you are. My name is Rick Brown. I work for WHO Thailand. Unfortunately, Dr. Jos van der Leyer, the WHO representative, was unable to record this introduction before he went on annual leave. But I am the focal point the focal person for this initiative. And so I'm very happy to welcome you all, set the context, and say a little bit about what WHO does around health emergencies. Firstly, as I'm sure you know, we're living through times where the frequency, scope, and impact of emergencies are going through some kind of transition. Outbreaks, often originating in animals, are occurring more frequently, sometimes resulting in global spread. Thanks mostly to climate change, we're seeing more and more extreme weather events. Human conflicts and population displacement both cause significant suffering, especially on the most vulnerable populations. All these events can impact human health, including not just the impact on individuals, but also the ability to deliver health services. As a result, WHO, in coordination with our many partners, have had to raise our game. What we're also doing is trying to adopt a truly holistic approach. What does this mean? Firstly, we have to be as prepared as possible for all the different types of hazard. But it's not just about preparedness. We also need to strengthen capacities across the whole disaster cycle, including risk reduction, preparedness, event detection, response, and recovery. Every response should be an opportunity to reflect and build back better. We are also critically thinking about the scope of work we cover, including all the areas where our work interfaces with other sectors. So I guess this is where this TechNay initiative fits in, at least for WHO. To put it simply, when viewed through the lens of health emergencies, can hospitals be designed better? And if so, if we did to try to do things better, can we reasonably expect a small but maybe significant improvement in the response to health emergencies, including maybe even patient outcomes? It's got to be worth looking into, I'm sure you'll agree. There is also one specific aspect of this that I'd like to focus on, which relates to the prevention and control of infections in a healthcare setting. You might be familiar with the architect Le Corbusier referring to a house as a machine for living. So maybe we should think about a healthcare facility as a machine for the delivery of healthcare. Following this theme, how can we design to reduce the risk of transmission of infections from one person to another, what we sometimes refer to as nosocomial infection? I'll cover this in more detail in another session, but I'd like to explain now why I think this is so important. Basically, being admitted to a hospital is a really significant life event. We go to hospital when we are at our most vulnerable, hoping and expecting that we will get better. But all too often, people admitted with one problem end up with another one, including another infection. And sadly, many of these problems are entirely preventable. In the medical profession, of course, we are concerned about nosocomial infection, including the related problem of antimicrobial resistance. But I think we must always remember our duty of care to every single individual and do whatever we can to not make a bad problem worse. So please, you all think about how you can help us to do our job better. Just one last thing about climate change. Those of us working in health can't really do much about this problem except to describe and model the potential impact, plan for the consequences, and advocate for change. But we can make sure we try to apply green principles in hospital design so that in a small way, we do walk the talk. Thanks for your interest and time to attend this course. I hope you have a great time. And of course, I'll see you later. Thank you.